Good afternoon, everyone. My name is Will Cook. I'm President and CEO of Vail Health, and I'd like to personally welcome you to the 2023 State of Vail Health. We know time is very valuable, and we appreciate you giving us some of yours today, and we want to try and leave enough time to get to questions at the end. So I'd like to go ahead and get started. Again, I want to say welcome to everyone. Next slide, please. I'd like to start off, if we can, by taking a moment of silence to recognize Dr. Dick Steadman, who has done so many things for so many people. First and foremost, the thousands of patients that he treated to extend their lives, to make them better athletes, weekend warriors. The impact that he had on our valley when he was recruited here in the late 80s, he and Dr. Hawkins and so many of the wonderful surgeons who followed, the impact that he had on the field of orthopedics. He was truly an innovator. His quality of care, his microsurgeries, getting people up and moving around much sooner than they otherwise would have had a lasting impact on the field of orthopedic surgery. But most importantly, he was a great man and a great father and a great husband. And so I'd like to just take a brief moment of silence to recognize Dr. Dick Steadman. We will miss you, Dr. Steadman, but you will never be forgotten. In fact, your legacy lives on through the hundreds of surgeons that you've trained. I know now with Dr. Philippon at the helm and many of the wonderful surgeons that they have, not only providing care, but doing world-class research, that your legacy will continue on through the quality of care that gets provided to people from all over the world. So thank you, Dr. Steadman. Next slide, please. Again, I want to welcome everybody, especially our partners. I always get a little bit worried about doing this because I'm afraid I'm going to forget someone, but really none of the things that we're doing at Vail Health could happen without partnerships. I attended the State of the County with the Eagle County Commissioners this morning, and it was so refreshing to hear them talk about all the exciting things that are going on in our county. I was especially interested in their focus on acceleration. And goodness knows, after 3 years of a pandemic, it's time to emerge and try to get back to some sense of normalcy and so much that's going on. But again, I think what makes this valley great, besides the beautiful mountains and the outdoors and all the things that draw us here, it's this common bond to constantly try and do what's right for the valley. And so I'm grateful for our elected officials. I'm grateful for all of the people who work in the various municipal governments, for law enforcement, for education, for Eagle County paramedics, our partners in the state government, for the schools, especially Superintendent Guaman, who's done so much to help us, other nonprofits, the Vail Valley Foundation, as an example, Mike Imhoff and Chris Jarno, thank you for your leadership, not just through COVID, but through housing and daycare, and the Vail Valley Partnership. Chris Romer and I have been tirelessly working on trying to make health insurance more affordable, and I know he's got some exciting things in the works there that are coming down the pike. Our benefactors, that's another thing of this valley. People are so generous of their time and their talents, but also their treasures, and the amount of giving that's taken place to help us try to tackle behavioral health is not only impressive, but it's incredibly appreciated. Our board members, they're visionaries. They challenge us, they support us, they give us resources. They too are volunteers, by the way, and we couldn't do it without them. And you all, as our community partners, the fact that you're participating today speaks to your commitment, and we're so grateful for you. But last and definitely not least, I'm most grateful for our providers. I'm most grateful for our staff. I'm most grateful for this management team who every single day does our very best to try and provide the highest quality of care and the best experience that we possibly can. We don't always get it right. And I got to tell you, we're going to talk about it in 2022. It's been a tough year, but just thank you to everybody. Without this collaboration, without these partnerships, we could not do what we're doing. So let's dive in if we can. Here's the brief agenda. We're just going to do a recap. That's okay. You can move on from it. A recap of 22, the priorities in 23, then leave a little time for questions at the end. So move forward, please. Thank you. You can go ahead and go to the next one. So we try to start every meeting, every discussion, every opportunity, every problem with what's our mission and vision? Elevating health across the mountain communities we serve. And how does that inform our strategic pillars, which are affordability, accessibility, population health, and sustainability? And I went through these last year when we were creating these, but I want to make sure you understand that our biggest strategic enabler, really at the bottom of the slide there, is our people and our culture. And it's such an important issue now, especially as we're experiencing great resignations and so many people leaving the workforce. But this will always be our North Star, and we'll use that as we go through the rest of the presentation. Next slide, please. All right, so FY22. So our fiscal year is November to October. It's that way because November through April, which is more or less the ski season, is about half of our fiscal year. It's hard to believe that Delta was happening in fiscal year 22, but yes, it was happening in November of 21, December of 21. Then Omicron hit here, as you all remember, in Christmas, not this past Christmas, but the one before. And it hit us fast and hard. We're always on the bleeding edge of that because of our international travelers. But that really was challenging for us. And I think that it contributed rather to 1 in 5 people leaving the healthcare industry. We knew baby boomers were nearing retirement, and goodness knows they deserve it. But I think that 3 years of COVID and all the challenges that it brought with it really expedited people leaving the healthcare industry. So 1 in 5, that's 20%. And as you can imagine, that's really created a lot of challenges for us. Your normal sort of global supply chain challenges, the inflationary pressures that have come, some pretty sweeping legislation at the state level and the federal level, the Colorado option as an example. And while we applaud all of our elected officials for trying to make healthcare insurance more affordable, we agree with that. There's a lot of work that goes into it, and there's a lot of things that are still happening as we speak today. We continue to struggle with insurance companies. We're not trying to villainize them, but we oftentimes are dealing with issues related with how we can partner better with our commercial insurance companies. There's a demographic shift. We talk about the baby boomers getting older and retiring, but that's a big figure. There's 75 million or so baby boomers. There's about 50 to 55 million in all the other generations. And so what you have now is a lot of people moving from the workforce to retirement, which means they're moving from commercial insurance to Medicare. And that definitely impacts our reimbursement rates and our revenue. It also impacts the type of services that we provide. So we're watching that demographic closely and figuring out how do we have to evolve. Cybersecurity attacks. If there's anything I can tell you, if you're not sure, don't click on it. We are constantly having to be very careful from attacks from all over the world, and not just to us, but to a lot of our partner organizations. We, in fact, were victims of an attack on our payroll system. There was an attack previously in the year, and we're required by law to report these things. And as we learn more, report more. But I want to make sure you know that we are very vigilant with this. We've spent millions of dollars in preemptive measures to protect ourselves. But it definitely is a huge challenge for us, not just in FY22, but and beyond. I think we've all been watching with almost kind of squinted eyes, our 401ks, our 403bs. Many of you sit on boards or you run your own businesses, and it's almost hard to watch what's happening in the financial markets. We went from 15+% positive returns to 15% losses. And all of these issues combined really have resulted in nationwide and statewide financial difficulties for all the health systems that are out there. So it was a tough year, but you know what? We're prepared for it. And I look forward to talking to you a little bit more about where we're going to pivot and turn our attention in FY23. Let's go to the next slide, please. As I mentioned previously, hospitals have been hit really hard. 3 years coming off a pandemic, ARPA fund drying up, the 1 in 5 or 20% leaving the industry, which has resulted in us having to use contracted labor. All of this has resulted in about 26% increase in our labor expenses, 24% increase in supply chain expenses. So in total, that averages out to about 21%. Other things had not gone up as high. But as you can imagine, 20% increase in your expenses is pretty detrimental as it relates to your financial performance. Next slide, please. So internal challenges, when we talk about a perfect storm, it's not just what's happening externally. And one could say that and the things that were happening externally alone were enough to be said perfect storm. But there was a lot that was happening internally, and some of the external challenges manifested themselves in internal challenges. So, as an example, we lost a spine surgeon mid-year last year. We had 2 urologists leave to go to Denver. I think you guys remember Dr. Connie Wolf. She's great. Dr. Stephen Moore retired, both citing challenges, daycare challenges. You can sell your home and make a lot of money. Lots of people began to say, goodness, I don't know that it makes sense for me to live in this mountain community anymore. It's either too expensive or I can't get my needs assessed as it relates to childcare. So we lost not just a lot of staff, but physicians, 3 primary care physicians to be exact. Our ear, nose, and throat doc took a sabbatical. We had 40% vacancy in key clinical positions, whether or not that was in surgery or clinical assistants, which are people who support our doctors in the doctor's office. As a result of it, because we didn't want to hurt service levels, we had to spend $13 million more in contract labor. I don't know if you've heard the term travelers, but what was coming post-pandemic when many hospitals were struggling to have enough staff to deal with the surge from COVID is that they were hiring contracted nurses who were traveling all over the United States. And it wasn't limited to nurses, it was in other positions as well. But whereas we would spend normally about $2 million a year on that, we spent $15 million. So there was $13 million variance just related to contract labor. And of course, we also were investing money in our own staff, both from a compensation and benefit perspective. So, real challenging year as it relates to people and it relates to labor expenses. I mentioned previously an external malware attack on our payroll vendor, Kronos, which thankfully got through, but was not at all something that was easy to navigate. We had about a $60 million reduction to our reserves based on financial market performance. And we've continued to see unprecedented degradation to our own financial performance. So know that this team is hyper-focused now on what do we have to do to ensure that we have strong financial performance, because it is, in fact, a strategic enabler. It's one of our pillars, in fact, sustainability. So we broke even in FY22-ish, just a little bit around there, but know that this is an area of focus for us as we move forward. Next slide, please. So despite all of that, there's many things that were still accomplished and things about which we're so proud. In fact, I would say that there's these milestone things that are happening in our valley at every turn. One of which was receiving the entitlement and approval from Eagle County. Thank you very much for our partners there and for the neighbors whose lives are being disrupted as we're doing this. We recognize that, and we hope that everyone realizes that this is for the betterment of our entire valley and those around us. But know that receiving entitlement for a new inpatient behavioral health facility and breaking ground on that is something that happens once in a lifetime, maybe never in many valleys. And all of this was happening while we're still managing COVID, opening up 2 new facilities in Summit County in the Roaring Fork Valley, which is all about bringing care closer to home. People were already coming from Summit County in the Roaring Fork Valley to receive care here. We're very proud to have maintained Leapfrog Grade A in quality. And we're only one of 429 hospitals. There are only 429 hospitals out of 5,000 in the US who received CMS 5-star rating. So we're in real rare company to have 5-star rating and be Leapfrog A. This is almost entirely related to an incredibly talented and dedicated team of providers and frontline staff who take quality very seriously and who are turning over every stone, are obsessed with failure, and constantly trying to figure out ways that we can get better. I want to also thank our quality committee of the hospital board, as well as all of the quality committees of our other subsidiary boards, whether or not it's in the ambulatory surgery centers or within Colorado Mountain Medical. Know that excellence is important to us, and it starts with good quality care. We continue to receive awards for patient experience. I'm especially proud of our emergency department that received the Prescani Award, Guardian of Excellence. If you haven't had a chance to visit the new facility, I hope you don't need to, because that means, at least in theory, that you're doing well and you're healthy. But we truly do now have a facility that I believe is consistent with excellent care that's been being provided there for years, but also with Mountain Resort Medical Destination. And again, thank you to all of you who supported that. We received community mental health center status. A lot of people say, Will, what is that? It's actually a really big deal. We were the first one in 40 years to receive it. I think we were number 18. I could be wrong there, Chris. Forgive me if I am. But what this does is it puts us at the table for funding for Medicaid patients who need behavioral health care. And it's an enabler for us because it provides some funding to let us do some of the things we're doing today. I mentioned already the inpatient behavioral health facility, but I also would be remiss if I did not thank the Precourt family for the very generous gift that they gave to enable that to happen. Having a 28-bed inpatient behavioral health facility here that's for both adults and adolescents is a game changer. And it's the final piece in a broader plan for what we can do to continue to provide the best possible care, in fact, comprehensive care in our valley. And look, 5 years ago, we probably had the least amount of services available. Now we have some of the most robust services in our valley. Someone had even asked the question, Will, what's the plans or what can we expect in terms of, plans for Eagle Valley Behavioral Health and Vail Health to deal with substance use disorder, more specifically alcoholism and addiction. And that's a problem in a resort town, right? Thankfully, we don't have as big of an issue with heroin and some of the opioids and other things that are out there, but alcohol and addiction is real because it's a party environment and people get sucked into it. And so I want to make sure you understand that we're focused on all of it, but we are in fact very focused on substance abuse disorder, alcoholism, and addiction. And in fact, we are already out there today with a licensed addiction counselor based in Colorado Mountain Medical. We have a ton of other services that are now available in our newly opened Uyghurs Mental Health Clinic. That's also over in Edwards. Huge thank you to the Uyghurs family for making that happen. We will be launching a substance use disorder specific intensive outpatient services so that people can begin to proactively address addiction and have access to services that let you capture that at every point along the way. These are groups such as Alcoholics Anonymous, and this is not just limited to adults, it's for youth. It's for all sorts of people who are struggling with addiction. So know that this is a huge area of focus for us. And we're very excited about where we're headed in all of our behavioral health services, but including substance abuse disorder and addiction. One of the things we've been trying to do is be better community partners, more visible, more engaged on community boards, present, contributing, leaning in, all the things that are so necessary to be successful here. And we try to track and monitor how are we doing. We don't just do that for patient experience. We try and do it for what the public perception is of us. And one of the more recent net promoter scores for us was about 77. Not going to try and explain that because I probably wouldn't do it justice, but know that we feel that it's starting to pay off and we will continue to be good community partners. And if there's ways that you think we can do better, please let us know. We always want to be the best partner we possibly can. And then lastly, employee engagement. We have an index of 82, and you again may say, what the heck is that? I will tell you it's very high. Most of the places I worked previously, we were in the high 60s, low 70s. In an environment of great resignation and 1 in 5 leaving the healthcare industry and all the challenges associated with burnout, it really is now more than ever important to focus on your people and your culture. That was why it was one of our big strategic enablers at the bottom of that framework I showed you earlier. So despite all the external headwinds and despite all the internal challenges, for all intents and purposes, I think it's been a better year for us. I again want to thank everybody who was a part of that. Next slide, please. So giving back locally, I could probably go on and on about this. I'll try to be brief. We gave about $25 million back to our community last year through a variety of local initiatives. All in over the period of time when we're done with this, there'll be over $200 million in behavioral health. But more importantly, what I see is a cross-pollination of all the various nonprofits and all the various municipal governments and all the various partners you heard me mention before. people's taking time to get to know one another better, to empathize and listen. I had breakfast the other day with our law enforcement leaders. I'm not going to call out names, but suffice it to say that we were there with Your Hope Center, myself, Chris Lindley. And when you hear what they're out there doing every single day, responding to difficult situations where patients, or people rather, may be having some sort of psychotic episode, they pose a danger potentially to themselves or to others, and all that they have to navigate to take care of people, you just begin to realize that we have to lean in. We have to give back locally. We've got to make sure we're at the table, locking arms and trying to address issues. So know that this is a very big priority of ours, and we're very proud of all the things that are happening across many different areas of our community. Next slide, please. So our focus in 2023, hard to believe it's already February. Our 2023 started in November of 22, so we're almost a quarter into it. Next slide, please. Here are the priorities. Continued navigation of the external headwinds. Unfortunately, I don't think this staffing problem is going to go away because, again, a lot of it was driven by baby boomers who are finally retiring, and again, they deserve that. So what we're going to have to do over the next 3 to 5 to 10 years is build pipelines, right? How do we work with our local schools? CMC has been an amazing partner. I'm surprised I didn't mention that earlier. I apologize. Colorado Mesa has been a good partner. How do we help create pathways for some of our local high school students who might want to actually be a nurse or be a surge tech or do whatever it is they want to do in our health system? And how do we potentially give them scholarships and have them do internships? So really, it's going to be all about people. And that's not just pipeline development. That's addressing the housing problem and addressing the daycare problem, really honing in on culture. Again, I mentioned the opening of the Uyghurs Clinic. That's a comprehensive outpatient behavioral health services clinic. It's beyond what you find integrated in Colorado Mountain Medical. This is for people who have intensive outpatient needs. And again, that substance use disorder service will be provided over there as well. We've broken ground on the Precourt Healing Center. As you all know, it's very hard to do much during the winter months, but we're getting at least this phase of the construction going, and we hope to have that finished sometime in 2025. Continued focus on affordability. It's not just what the hospital charges, it's what the insurance premiums cost. And we're not the only health system that's in some of those products that get sold. In fact, our population represents oftentimes a minority of it. But that's why we're trying to work with Chris Romer and the Vail Valley Partnership on a new entity that's called the Mountain Healthcare Coalition that stay tuned. Chris and his team are doing a great job of getting that going, and we will be there every step of the way to do our part to ensure that we are contributing in a positive way to health insurance affordability, because that also is highly correlated with accessibility. Unfortunately, we can't provide every single service here. There's oftentimes not enough volume to ensure quality or enough volume to ensure cost efficiency. And increasingly, because of the shortage of providers and the 1 in 5 who've left, we've struggled to keep some of our doctors. So I just want to proactively, number one, tell you in advance that we are sorry about drops in our service levels, difficulty in particular with Colorado Mountain Medical earlier in the year with trying to call, schedule an appointment to get something from your doctor. When we started to lose 40% of our staff, we attempted to implement technological solutions that didn't work. Thank goodness we recruited David Kaplan, who's our new president of Colorado Mountain Medical, to come in and give it a fresh look. And I want to make sure you all understand it's stabilizing, but there's no one more committed to providing timely and good care than those Colorado Mountain Medical doctors and staff. They have been through the ringer in the last 6 to 12 months. And I ask for your continued patience. And this isn't just limited to Colorado Mountain Medical, to some of our specialty physicians and Vail Health clinics, to all of our docs. Trust me when I tell you, they're working very hard. They're doing their very best. We just literally have about 20% less of what we used to have. If it was 5%, you wouldn't feel much of it. but these are significant hits we're feeling in terms of lack of people to help us provide the kind of care and the service that we want to. We will get there, though, I assure you, and we appreciate your patience. We're going to always look at orthopedic service line. Going back to Dr. Dick Steadman, he's a pioneer. He put us on the map. He put Vail Health on the map. And I'm very grateful for Vail Summit Orthopedics and Neurosurgery. They have some wonderful doctors as well. And so as long as we live in this mountain community, we will always be focused on orthopedic surgery. And then lastly, financial sustainability. As I mentioned before, we have to have the margins in order to carry out our mission. And we need to make sure we're always on solid financial footing. And while we currently are in that place because of many years of disciplined work and strategic decisions, like many of you who run your own businesses or work for other boards, this will be a hyper focus for now as we get through some of these unprecedented external headwinds. Next slide, please. So don't have time to give this the detail it deserves, but I want to make sure you understand when we think about that strategic framework, and I said affordability, that's pretty intuitive. You know what it means. Accessibility, I think that's also pretty intuitive, and we talked about that. You heard me talk about sustainability, but the next one really is population health. And people are like, I'm not exactly sure what that means. Can you help me understand? And it's really about how do we think about whole person health? How do we think about their physical needs? How do we think about their behavioral needs? How do we think about social determinants of care? You know, all of these things are like a big set of Venn diagrams that are all sort of overlapping. And how do we recognize and acknowledge that we sometimes have to bring care to the people? How do we focus on prevention and early intervention, get upstream to problems, right? Rather than not addressing the affordability problem, the accessibility problem, and therefore then managing someone's health proactively where we can see if they have early onset fill in the blank, or see if they're having blood work that would indicate that maybe there's something more serious coming on, and then waiting until later when A, they don't have as good of a chance to effectively deal with it, and B, it costs a lot more money. We're trying to get upstream at every turn. And I got to tell you, don't mean to be political here. Thank you for those of you who got your vaccinations. Thank you for those of you who wore masks. And thank you for those of you who sheltered in place in the early phases of all of the COVID pandemic and throughout. But I'll tell you what you heard us say once before, your best shot at beating COVID, at beating whatever comes after COVID, at living your fullest life, at beating all the other diseases that ultimately we're running from as we get older in life, is to really focus on your baseline health. Pay attention to your diet, get some exercise, get out in that sunshine, enjoy these beautiful views, see your primary care physician on a regular basis, make sure you hit your screenings for whether or not it's mammograms or colonoscopies, all the things. And our community health improvement plan is centered around making it easier for people to do that. How do we also think about early childhood and family supports? I mean, so much happens between the age of 0 and 3. And we have so many wonderful partner organizations that are in that space. How do we think about interoperability and integration so that when a patient comes from, say, Vail Health to Mountain Family Health Center or some other place, that we can share information and talk with one another and not repeat things all over again? And lastly, again, it gets into this, what are we going to do to improve community health and increase access to lower cost care and really drive engagement? If you have any time and you think to anything as a follow-up to this presentation, I would encourage you to go online and look at the community health needs assessment and the corresponding improvement plan. There's an email address there for Amy Levine. She and Chris Lindley, the population health team, so many people deserve credit, but this is really, from my perspective, the most important thing on which we should focus. Next slide, please. All right. You heard me say before, it's about people. I want to make sure you understand, because a lot of people, the naysayers, and there's still some out there, and that's okay. That's life. But someone said, hey, you wouldn't have all these staffing vacancies if you would pay your people more. And I want to make sure you understand that for fiscal year 23, we are spending $194 million on compensation and benefits. That's a $7.8 million year over year increase We just put $20 million into Fox Hollow to create more housing. We're talking to a variety of daycare operators to see how we can help them, address some of their challenges. We're with the Vail Valley Foundation on their task force. We're all leaning in, but I want to make sure we're really investing in our people. Next slide, please. You just heard me mention the employee housing at Fox Hollow. This is a very unique arrangement. And I'm just going to, for a second, let Craig Cohn, if you'd pop on, Craig. He's our Chief Real Estate Development Officer and was really the person behind this. And I'm going to let him very briefly describe this to you because I know I won't do justice. And I definitely want to make sure I give Craig credit there. So Craig, would you mind just walking through this slide briefly?
Thanks, Will. Happy to. Good afternoon, everyone. Fox Hollow is located on Highway 6 in Edwards. If you're heading west from the gas house, it's a large vacant lot before you get to the Interfaith Chapel on the left-hand side or the south side of the road. It's that big vacant lot, and then behind it is where there are a couple 3-story apartment buildings, if that helps give you an idea. You can see a rough rendering here of what we're going to do. Groundbreaking is next month in March. This is 87 individual units. They range from 1 bedroom. It's mostly 1, 2, and 3. There happens to be 1 4-bedroom unit. Some have garages with ample surface parking. And this will be 218 beds. To give you some perspective, we currently lease about 160. So that move is, 137%, as you can see there on the screen, increase in the number of employees that we are going to be able to house here in Edwards. And what I think is really unique about this, the 160 beds that we currently have really been focused on short-term use. It's how we help folks move to the Valley. It's how, we work with some travelers when we've got shorter time frames. What we haven't had enough inventory to do historically is really start to address long-term housing needs. And by having this much inventory in one location, we're going to be able to start focusing more on long-term leases, meaning recurring 1-year leases for many, many years, so that if someone's coming here or looking for a place to live, yes, you won't own it, but you can count on living in it for a long time. And lastly, we're still working on it. It's a work in progress. We'll have it done certainly before construction. We're working on both the selection process on how you get access to these units, as well as the rental rate process to ensure that the rents that we're charging are not necessarily tied to what market rent is in the Valley, but tied to what's affordable based on what you make. And that will be part of your housing application process to get a long-term lease at Fox Hollow. Will, did I cover what you're looking for there?
You did a great job with it, Craig. Thank you again. And, he mentioned this, but I'm just going to underscore it. This is one subset of housing opportunities with a very deliberate purpose. We're also looking at further increasing the number of units that are available for our staff and trying to solve for that problem, because if we don't solve for the housing problem and the daycare problem, we're not really, in my opinion, positioning ourselves to solve for the broader staffing problem. So thank you again, Craig. And the question on the screen was, could you please share if this housing project is a completely new build? And if so, do you have community and philanthropic partners involved? So do you want to grab that one, Craig?
Sure. So this is a completely new build. If you drive by it today, that's a vacant lot. It's fully entitled with Eagle County. So we're allowed to build what you see there. The entitlements are actually a couple years old. The way we are developing in this is with a third-party real estate development company, Breckenridge Grand Vacations Edwards. They're a well-established developer both in Summit County and here in Eagle County. So they are bringing the financing for the construction portion. They are overseeing the construction. They will help manage the buildings long-term. And we will be doing a combination of purchasing a portion of what you see on the screen and leasing the remaining inventory that you see on the screen. So it will be 100% Vail Health occupied, but not 100% Vail Health owned, if that answers the question.
I think it does, Craig. And I think another question came up from Pete. Pete's good to hear from you. We provide transportation to and from. Craig's shaking his head yes. Yep. And I know also we provide transportation now through a variety of places with our fleet of shuttles. But I got to tell you, one of the things I'm very excited about, and want to thank all the voters in Eagle County for approving the Regional Transport Authority, which I think once we leverage and lean in on all the various resources that are in that space, and we make it easier for people to move up and down and across our valley, it will really help alleviate to some extent some of the challenges with staffing and where people buy versus, or where they live rather, versus where they work. So thank you for those questions. And thank you again, Craig. Interest of time, I'm going to move to the next slide. So behavioral health. Chris, would you mind taking your video off? See if I can see you. There's so many people in the Hollywood squares. Yep. There you are. Just want to give them just a brief update on behavioral health and tell them about some of the exciting things that are going on, and as we're kind of bringing it in as a service line for Vail Health.
Yeah. So just real quick history. Just a few years ago, at least for the Vail Health system, we didn't have any behavioral health providers seeing patients for behavioral health services. That all changed in late 2019. With Colorado Mountain Medical bringing behavioral health into their practices across all their clinics. That transition has led to what is now a large behavioral health service line that's serving all patients. So we accept Medicaid, Medicare, all commercial insurances, as well as those that don't have the ability to pay. We have a great scholarship program that's in place that's called Olivia's Fund. We have integrated behavioral health within Colorado Mountain Medical, as well as outpatient behavioral health here on the Edwards Community Health Campus. As Will mentioned, we are very excited. I'm actually here today in the Wiggers Mental Health Clinic. It's fully up and operational, and we'll soon start group and IOP, transmagnetic cranial stimulation, as well as ketamine in the coming months moving forward. And last, and certainly not least, the Precourt Healing Center, which will be an inpatient facility, but the way it's been designed and the way we're looking at the future operation of it is it will be a healing center, not a confinement center. It's going to be a place for folks to come and get stabilized, get back on the right track, and immediately step down into the services in our outpatient facility where the real long-term healing will take place with their providers and community members going forward. And last thing is just, there's our website there for folks that need it. All the information is right there. Thanks, Will.
Thank you, Chris. Really appreciate it. Adding 50 plus behavioral health providers and even more staff and all the things that have been happening over the last 3 years is really transformative. And I'm so grateful to Chris and the Eagle Valley Behavioral Health team. If we can, we'll go to the next slide. So the community health campus, first of all, it was the strangest thing shoveling dirt on concrete. Secondly, it was one of the most special moments in my time here. As I'd said to you previously, one of the most special moments was when the board was literally clamoring over one another to vote to make the move on the $60 million commitment for behavioral health. And that began to culminate and manifest itself in the actual groundbreaking of an inpatient behavioral health facility. I just couldn't be happier for this community and prouder of so many people who are involved, all the people I've mentioned before. So we look forward to opening this thing in sometime in 2025. Again, we're trying to get some of the foundational things in place like housing and daycare and all the rest of it. So thank you to all of you involved, and we look forward to getting that going. Next slide, please, if you don't mind. These are some renderings. You can see, as Chris mentioned, a healing center as opposed to an area of confinement. And again, I want to say thank you to the neighbors that are close to us. I know it's disruptive during construction. We're doing our best. It really is never good for anybody to have to be disturbed, and we're grateful to everyone as we try to move through this as quickly as we possibly can. On the other side of it is truly a beautiful facility that's going to be wonderful for this valley and so many that are close to us. So thank you for that. And next slide, please. Before we go, Amanda Veit, are you on this call? You should be. I know you're always there. Would you mind just real fast taking your camera off? Maybe you guys can't see her. Maybe she's listening in. She's probably actually doing what she normally does, which is run the hospital, and very well. But I wanted to just say thank you to Amanda Veit. She's our chief nursing officer and our chief operating officer. She gets the joy of doing two jobs. But she's one of the big reasons in her clinical team that we've done so well with quality and with patient experience. And she helps along with her team to ensure that all the trains are running on time in surgery and all the rest of it. So anyway, just want to make sure I give thank you to some of my key execs. And again, just end where we started, which is thanking all of you, Lindy Owens, or whom I think I can see that correctly. My eyes are getting worse. Thank you for the nice shout out there. It's been a privilege and an honor to serve in this role and to work alongside so many committed people in the management team, the board, and the community. And we hope to continue to be good stewards, good partners, and we look forward to the next 3 years. So with that, I just want to pause and ask the folks who are helping me if there's any other questions we need to address that were sent in advance, anything of that nature, Chad or Sally.
No, Will, you've addressed all of the questions that were sent in advance. If anyone has any further questions, please submit them into the chat and we can address those now. Thank you.
Thank you, Sally. While we're waiting on one, and maybe we won't get any, and that's totally fine, know that you're always welcome to reach out to me directly. We're trying to be accessible and available ourselves. My email address, it's real easy. It's will, WILL.cook, COOK, at vailhealth.org. Any thoughts, questions, comments, concerns? If you feel more comfortable in a smaller environment as opposed to putting something on a chat or even asking questions in another way, you can always reach out to me. We'll do our best to try and get the question answered. I see one here. Any previous discussions around light rail on the unused railway? Craig, help me in case I get this wrong, but I've asked that same question, what's ever going to happen with the railways there? And I think it's tied up and owned by some of the former railroad companies. Craig, can you speak to that, or can anyone speak to that question?
I'm not an authority, but I know that the rail line that runs next to our site, next to the Precourt Healing Center, that's Union Pacific. We're certainly working with them for construction. And I know that we have to construct in such a way that if they choose to reuse those lines at some future date, nothing impedes that, and they have the ability to make those lines active again. But I don't have any information from them that says that's something they're doing at this time.
Okay. Got it. Thank you, Craig. And Don Falk, thank you for that. Welcome. We love having people in from out of town. I'm from Mississippi. I have boiled peanuts in my freezer. I always sort of joke about that. I have family that lives in Atlanta. I'd love to meet with you actually at some point, so maybe we can connect. And I see someone says, do you see the doctor, this is from Craig, do you see the doctor availability getting better anytime soon? Honestly, Craig, I don't. I actually see the combination of some of the boomers who are retiring also being physicians, and the challenges associated with trying to recruit people to the mountains where it costs a lot more. And in many instances, especially once you get into very subspecialized care, there's 55,000 people that live in this valley, but the incidences of disease are oftentimes based on, per 100,000. And there's not enough of that incidence for folks to ensure they're getting the sort of breadth and depth of experiences that they want. So I don't see it getting any better anytime soon, but I do know that they're looking at the federal level on what do they have to do to entice more people to go into medical school. Once they're in medical school, how can they entice them to pick the specialties where we have the greatest shortage? For me, it's all about geriatrics at this point. Internal medicine docs who are really subspecialized in taking care of the elderly. And we've got a huge opportunity. I was emailing with someone from the community whose name I won't say about how can people continue to live in the mountains and not feel forced to go, to Denver or somewhere else, and what's needed there. So we've got a lot of work to do in that space as well. Let's see. I see one from Candy. Because Vail Health is now in Summit County, are there any collaborative efforts to elevate healthcare across the county and mountain communities, even if Centura St. Anthony Summit is a competitor. And I'll take the first part of this, and I'm going to ask Chris to jump in on the second one, Chris Lindley. First and foremost, we believe that competition is good. Vail Health has been in Summit County for the better part of 4 decades. Many of our surgeons and our other doctors would travel back and forth, as would patients. And goodness, hindsight's always 20/20. I really wish back in the day when the hospital was being built there, we would have built it and we'd have been the provider. But we can coexist with Centura and St. Anthony Summit. We have nothing negative to say about them. They serve an important role. But increasingly, where we're trying to provide care is in the space of oncology and orthopedics, and now increasingly behavioral health. So maybe, Chris, you want to talk about that briefly?
Absolutely. In Frisco today, we have 2 behavioral health therapists that are operating out of there, seeing patients every day. We actually had some amazing interviews today for a couple new psychiatry candidates. So these are MDs, and good news, Will, is we've got 2 more adolescent and childhood psychiatrists that are interested in joining the team, and we're hoping one of those would be available to serve the Summit community. Last and not least, we are working with Summit County government officials to, we believe, become their community mental health center down there. And what that means is we'll try to provide them with the same level of support, collaboration that we're doing up here, but working with all of their nonprofits down there. So it won't take anything away from here, what we're doing, but hopefully we can share the lessons we've learned here with that community as well.
Great. Thank you, Chris. And, just so people understand, we were have been receiving a lot of patients driving over the Vail Pass to come for oncology care at the Shaw Cancer Center. And so now, we used to provide chemotherapy over there 1 day a week and some other cancer services. Now we're there 5 days a week. We have the Dillon Health Center that's over there that does primary care, specialty care, urgent care, Shaw Cancer. So it's not just orthopedics, not just behavioral health, but we're glad to be over there, and we're going to do our best to be good community partners there as well. Someone asked if there's a long-term plan to build an employee parking tower on the west end of the main hospital. I think the short answer there is no. I don't mean that disrespectfully. Thank you, Roberta, for bringing it up. The bottom line on it all is we're trying to limit services that only need to be in the Vail Health Hospital, because parking is such a challenge in the village and traffic is a challenge. And just to build a parking spot there is like, Craig, I'm going to say the wrong number, but several $100,000. And so I don't think we'll be putting an employee tower there, but we will look at ways that we can continue to bus people in. We appreciate if you're one of our employees that's having difficulty or having to take a shuttle, we thank you for leaning in there. Julie Groff, I know Julie. I know Fletcher too. Will, you and everyone's done a wonderful job. Thank you. Neil too. We really appreciate these families that have been here for many generations and who are wildly supportive. Thank you, Julie, for the nice words there. And Julie Sutter, if I said your last name wrong, I apologize. Do you envision any housing initiatives in Summit? And I'm going to pause there and let Craig pop back in to maybe speak from a more educated place.
Thank you. We do. We're currently master leasing many residences in Summit County to kind of support the growth of Dillon. We haven't committed to a longer or larger program as we're still building out that facility and the volume is still growing. But we are actively in communication with a couple of opportunities in Summit County and continue to monitor the need for, or the opportunity and the need, I should say, to make a larger investment in Summit County as well.
Thank you for that, Craig. Here comes another one. Let's see. Is there any? So, Chris, there's one here that says Robert Shear, and I don't know if you can read. Maybe it's only on me because I'm a panelist, but it says, I see that only peer support program available is the My Future Pathways program. Is there any push for additional peer support groups similar to AA that might assist with those in recovery in our community? Can you grab that one?
Absolutely. What I'm going to do is I'm going to go ahead and put the direct link up here. It is off the Vail Health website, but I'll send that for everybody to see. We have all the peer support groups up there, including AA and all those community meetings. So I'll put it in the chat.
Put it in chat. Okay, great.
You bet.
Super. And I know part of, for those of you who are listening, when we talk about how we're trying to build the whole spectrum of services, and we started with just hiring more providers and then tried to integrate it in primary care, specialty care, the schools, the jail. And we still have challenges like, even, talking with Sheriff Van Beek, and how can we get more people to the jail? So we're not exactly where we want to be yet, but the goal is through the intensive outpatient services that come through the Uyghurs Clinic is to have these support services for all these needs. So that if unfortunately you find your way into the inpatient side of things with acute care, and then you want to get discharged and then sort of re-enter back into normalcy, your regular life, you ultimately then have these peer groups because so many other people are struggling with these things. So Chris, I think you said you were putting into the chat the link, or you would be putting it, and I see it there just now popping up. If anybody can't find what they need, please send Chris or myself an email and we'll make sure we get you attached. So still kind of taking a peek at the panel and the questions here. I don't see any more. Let's see. Mercy, well, thanks for pointing that out. Okay, so good. So maybe we can also look at how we list it. Well, it's 2:50 and we still have a few minutes if somebody wants to ask any questions or make any suggestions in terms of topics that you would like to hear about at a future State of Vail Health. I'm always open to that as well. Well, I'm purposely going a little slow here in case another one pops up, but just want to again say thank you to everybody for all that you're doing to help us try and fulfill our mission and to really improve the health across the various communities in which we serve. And we really look forward to, from my perspective anyway, getting over these sort of current external headwinds and this perfect storm that's brewing, and try and get back to a life that's less stressful and a life where we're not constantly navigating pandemics and dealing with all the things. And I encourage you to please pay attention to your body, pay attention to your physical health, your mental health, talk with people. It's okay. The starting point is knowing that there's a problem. The next step is then taking action on it. And if we can help any of you in any way, please let us know. Thank you again for your time and your attention and your Amanda Veit, I just saw your video pop up. Before we go, would you just say hello to the folks and introduce yourself?
Hi, everyone. I'm Amanda Veit. I'm the COO and Chief Nursing Officer for Vail Health, and it's an honor to get to serve so many people.
Thank you, Amanda. Really, literally, you have no idea how much she does behind the scenes to make things work right. So thank you, everybody. Have a great day. Be well, and we look forward to seeing you the next time. God bless.
Thanks so much.